In terms of school, I went to Foothill Technology High School here in Ventura, and I was very involved in the GSA, the Gay Straight Alliance there. And since, I guess in junior year is when I started getting involved, and then senior year I was actually president of the GSA, and so I tried to get as many people involved in that as possible, straight allies and LGBT youth included. And we ended up doing barbecues and things like that, getting in touch with other GSAs too, so we could network for the kids, because a lot of times that's very hard for LGBT youth to do, especially when they're not out. And I've also been working with Rainbow Umbrella since, I guess, January. I've been a junior facilitator there, working with the youth. And I'm also volunteering for the parent organization Color, community organized for liberty, opportunity, and respect here in Ventura.
At Foothill, we when I was in 9th grade, we had this. We did the regular sexual education class, and I learned about AIDS and the way it's transmitted, and what type of disease it is. If it being a virus disease and not a bacterial disease, and if it's curable, and some of the research and some of the history. And then last year in my AP U.S. history class, we did learn. We had a couple lessons for about a week. We learning about the AIDS outbreak and the crisis in the 80s and the kind of politics behind that.
Well, I was involved with GSA. I was since sophomore year, so I guess that would be 2009, 10, those years. I wasn't really doing much then. I was just kind of going. I wasn't out yet, so it was just sort of testing the waters. And then next year, I was more involved. Still wasn't in the ranks or anything like president or something. But then senior year, I became vice president, and we didn't do much, but we did meet and we talked, and we were just pretty much there if anyone needed our help. We were there as more of a support system. And then I also was involved with Color for a while, helped them do their garden things, and helped them with the AIDS walk and all that. And then I started going here, with the Rainbow Alliance a few years ago, started with them, and then after that fell through, started going here since the beginning. So. Well, we help Color with their AIDS walk. We hand out flyers and pamphlets and just congratulated people as they walk by. And we also help Color package these like safe sex kits. It had like a condom and a little safe sex like pamphlet in it. And I think they handed those out at Patty's.
I've always tried to give education out in whatever situation I am. I'm a very open kind of person in that if you ask me a question, most likely I'll have the answer to it, or if I don't, I'll refer you to someplace that can give you that information. So other than just actively giving AIDS and HIV education, out in regular life, I've worked with Color in assembling safe sex kits to be passed out to bars and during the AIDS life cycle and during the AIDS walk. I attended the AIDS life cycle. I didn't get to participate in that, but I think that was an educational tool that the whole group at RU was able to utilize and absorb, and I was sort of facilitating during that. But other than that, I haven't had that much experience with the HIV and AIDS education system and network. I think education is always good, so we could always use more tools in everything, but especially in HIV/AIDS awareness. I think that it would be really beneficial if we had some of the groups here in Ventura County and really everywhere help them with establishing ways to get tested if they would like to, and providing them with safe sex kits and condoms and whatever they need to keep themselves safe. I think it would also be really great if more organizations could do some sort of campaigning as to how someone can establish a support network if they do have HIV and AIDS, or even if they want to get tested, because sometimes that can be really scary. And I've known even people to make a day out of it and to go with a bunch of friends and get tested and like go to lunch afterwards or something. And I think that if we gave them ways that might be a little bit less scary than just going by yourself, worrying the whole time, that you can make HIV/AIDS testing and awareness a little bit more pleasant.
Well, clearly, like with the internet, you can always get information. Whether or not that's accurate information is up to the person. But I think if you want to find information, it's there for you. In Ventura, we definitely have the information. Maybe not so upfront, especially with schools. I mean, we came from Foothill, so that we had a good education. I don't know enough about Bueno or Ventura or all the other schools to know how well their sex education was. My friends from other schools they're doing well, they know. I think our biggest problem would just be money, and also with private schools, they have their own curriculum. Who knows what they're teaching the kids?
I think that as a whole, Ventura is a little bit more liberal and a little bit more open to safe sex education and HIV/AIDS education. I know that there are issues in Oxnard and some other cities in the county as to getting that information out, because there are more conservative families there, and though I respect their values, it can be an issue when you're looking at the safety of the youth. And I think that when you're in such a small county relative, of course, to other counties, big cities and things, it can be hard to convince families that this is something that is very vital, and it's not going to hurt them as much as it would if they got themselves into a situation in which they contracted HIV or AIDS or some other venereal disease. Yeah, I definitely think that if the youth were more active, that there would be a lot less, there would be a significant decrease in people that are contracting HIV and AIDS daily, and however else you want to measure it. I think that it is very tragic that California has cut prevention and awareness programs for HIV/AIDS and other diseases, because I feel like right now it's catering to the sort of sick system instead of the healthcare system that we're supposed to be having, because it should be focusing more on preventing those diseases so that they don't have to waste so much money on things that might not work in curing people, or spending so much more money on these different things that they'll need because they contracted it because they had no idea what they were being exposed to. And I think that when you arm the youth with something like that, with this kind of tool to protect themselves, that it ends up being a lot less tragic than it would be if they had contracted a disease.